On July 30th, 1904, the heir to the Russian throne was born. The boy, who was the son of Tsar Nicholas II and Empress Alexandra, was named Alexei. In his first several months, his family discovered that he had inherited the gene for hemophilia from his mother, who was a carrier and inherited her gene from her grandmother, Queen Victoria. Hemophilia is a rare hereditary disease in which blood does not clot normally, leading to excessive and abnormal bleeding from injuries. Descriptions of excessive bleeding were first recorded centuries ago in the New Testament of the Bible and the Jewish Talmud. It wasn't until 1803 that hemophilia was identified and recognized for its genetic tendencies by John Conrad Otto. He researched the bleeding disorder back to a female ancestor living in Plymouth, and he said that though women could carry it, men were the bleeders. In 1947, Alfredo Pavlovsky, an Argentina physician, distinguished that there are two types of hemophilia, A and B, by analyzing factor deficiencies in genes. People who have hemophilia cannot produce the proper proteins needed to form a fibrin clot, a strong strand-like plug that dissolves when the blood vessel walls heal from an injury. Because of this, some symptoms include bleeding from a minor injury, bleeding into the joints, bleeding into the mouth and gums, and internal bleeding, which causes bruises. The life expectancy of hemophilia patients varies depending on the quality of treatment. If the treatment is lacking, it is likely the patient will die before adulthood. With more adequate treatment, the life expectancy is still 10 years less than someone without the disease. If you have a family history of hemophilia or exhibit any symptoms, you will be given a clotting factor test, which will measure the level of factors 8 or 9 in your blood. In the 1960s, hemophilia was treated by injecting whole blood or fresh plasma into the patient. The problem with this was that the blood did not have enough clotting proteins to prevent internal bleeding. Now, replacement therapy is used. In this treatment, concentrations of clotting factor 8 or 9 are injected to replace the low or missing proteins. Hemophilia is a hereditary autosomal recessive disorder. It is sex-linked and it is carried on the X chromosome. Since females have 2 X chromosomes, a mutation must be present on both to cause hemophilia. This makes it so males are more likely to inherit it. Since it is caused by a lack of clotting proteins or factors, hemophilia is considered to be a gene mutation. Hemophilia occurs in 1 out of every 5,000 male births. On April 17th, World Hemophilia Day is recognized to raise awareness of inherited bleeding disorders. With donations to further research, people all over the world living with hemophilia can live a healthier life.